Hello, everyone. Welcome to today's review session on renal disturbances and management. And we'll cover hemodialysis and peritoneal dialysis, kidney transplantation, renal calculi, acute kidney injury, and chronic kidney disease. We'll also include pharmacological management and benign prostatic hyperplasia and TURP and rhabdomyolysis. And so our goal is to help you strengthen your critical thinking and clinical judgment so you can confidently answer NCLEX RN questions related to renal care. So let us know how you did on the practice test by commenting below. Let's get started with our Q&A. Question number 1. While a client is undergoing dialysis and experiences disequilibrium syndrome, what should the nurse do initially? Options: A. Reduce the dialysis flow rate. B. Position the client with the head lower than the feet. C. Provide comfort by explaining that these sensations are typical. D. Deliver oxygen via nasal cannula. The answer is letter A. The first step in managing the dialysis disequilibrium syndrome is to slow down the dialysis flow rate. And why is this? It's because the syndrome happens when the solutes like urea are removed too quickly, which causes the fluid to shift into the brain cells. This leads to the cerebral edema, and this can result in headache, there's nausea, confusion, or even seizures in worst cases. And so by slowing the dialysis, the brain gets more time to adjust to the changing fluid balance. This will help prevent the symptoms from getting worse. Now, what about letter B? This is the Trendelenburg's position, right? And so this is something that the nurse should not do because this can increase the intracranial pressure, which could worsen the cerebral edema. And since the dialysis disequilibrium syndrome already involves brain swelling, and when you lower the head, this is going to worsen the situation. What about letter C? Provide comfort by explaining that these sensations are typical. Well, this is not the best answer. We know that reassurance is important, but it's not enough on its own. And we know that the syndrome requires immediate action to prevent worsening neurological symptoms. It's not something a patient can simply be comforted through. And calling it as a typical sensation is downplaying the seriousness of the condition as well, which could delay the proper intervention. Letter D, deliver oxygen via nasal cannula, is also incorrect. We know that oxygen therapy is going to help in many other situations, but this will not address the root cause of the disequilibrium syndrome, because our issue is not about hypoxia, but rather the rapid osmotic shifts which caused the brain swelling. And oxygen alone won't resolve that issue. And so for this test question, I want you to look for that intervention that directly addresses the cause of disequilibrium syndrome. And remember that slowing the dialysis process is the only answer that will help the root cause. And always focus on interventions that address the main root cause, not just about the symptoms. Number 2, a nurse is evaluating a patient scheduled for kidney transplant surgery to identify factors that might heighten surgical risks. Which of the following observations increase the patient's risk profile? Select all that apply. Options: A, takes glargine insulin every night. B, has a body mass index of 41. C, maintains an average blood pressure of 120/74. D, is 71 years old. E, previously diagnosed with lymphoma. Well, this question is about evaluating the factors that might increase the risk for a patient scheduled for a kidney transplant surgery. And so when considering surgical risks, we need to focus on factors like the underlying health conditions, the comorbidities, their age and other specific issues that might complicate the transplant process or their recovery. And so the answers here are the following. We have letters A, B, D, and E. Now, why letter A is correct? Well, we know that diabetes is a major risk factor that increases the client's risk of complications during and after surgery, especially with kidney transplantation. And the glargine insulin is known to help control the blood sugar levels, and the diabetes can also lead to the several issues. It will delay the wound healing. There's going to be issues with immunosuppression, and there's higher risk of infections as well. Now, with the diabetic patients, they need to have careful blood sugar control after a transplant because immunosuppressants that they're going to be using, especially steroids, can raise the blood sugar levels, and this increases the risk of infections. There's going to be slower healing and the possibility of graft issues, and that's why this is one of our answers. Now, what about letter B, body mass index of 41? Well, 41 is classified as being morbidly obese, which is a significant factor for kidney transplantation. And we know that obesity increases the chances of surgical complications such as infection, there's wound dehiscence, maybe respiratory issues, and also making immunosuppression therapy more challenging. And in addition to that, there's going to be poor vascular access and a higher likelihood of delayed graft function, which will further complicate the recovery. Now, letter D, which is 71 years old. We know that age is a critical factor in assessing surgical risk, and age over 70 years old significantly increases the client's likelihood of having complications during the surgery, as well as long-term immunosuppression issues. And with older adults, they have a greater risk for developing infections. There's delayed recovery, organ rejection due to age-related issues and changes in their ability to handle medications. And of course, we have letter E, previously diagnosed with lymphoma. Now, a history of lymphoma signals immune system dysfunction, and the lymphoma itself affects the lymphatic system and immune response. And prior chemotherapy or maybe radiation may leave the patient in an immunosuppressed state, and this can increase their risk of infections, maybe organ rejection after a kidney transplant. And so this makes lymphoma another significant surgical risk factor. Now, what about letter C? It's quite obvious with this blood pressure of 120/74, which is considered as the main average for this scenario. Well, this is going to be normal. It supports healthy kidney function and surgical outcomes, and it does not increase surgical risk. And so this patient's blood pressure does not pose a concern for transplant surgery. And so when you are the nurse assessing for risk factors for a client going for a kidney transplant, you gotta go for the client's age and also look for the comorbidities that could complicate their recovery. You have to pay close attention to diseases like diabetes, maybe there's obesity, older age, and history of cancer or other immune disorders, because these can increase their risks like poor wound healing. There's going to be immunosuppression and organ rejection. And also look into the fine details that we have in our options. We have insulin, which signals diabetes, high BMI, indicating the obesity of the client and the advancing age as well. So don't miss out on those fine details. 3. While a client is on hemodialysis and receiving heparin, how should the nurse explain the purpose of anticoagulation with the following statements? Options: A, heparin stays outside your body, so bleeding risks are eliminated. B, we add heparin to the dialysis unit and use protamine sulfate in your system to cancel out its effects, creating localized anticoagulation. C, after each session, your clotting time remains significantly extended for hours. D, to keep your blood from clotting between dialysis treatments, you'll be given warfarin sodium. The answer here is letter B, because this statement is accurate. We know that heparin is infused into the dialysis circuit to prevent clotting inside the machine, not the entire body of the client. And this is used to minimize systemic anticoagulation. And also, protamine sulfate is used to neutralize heparin before the blood re-enters the blood circulation. And so this process will ensure that blood flows smoothly through the dialyzer without causing excessive bleeding after the dialysis. And so the key concept about this dialysis is localized anticoagulation, which simply means that heparin is mainly active within the dialysis system rather than affecting the client's entire body for an extended period. Now, why is letter A incorrect? It's because bleeding risks are not completely eliminated here, even though heparin is mainly in the dialysis circuit. Though a small amount can still enter the bloodstream, this will increase the risk of bleeding. And even though dialysis nurses carefully monitor clotting times to ensure heparin it's properly neutralized, but some residual effects may persist, and though it's making the statement really misleading. And so we are discarding this option. Now, letter C. Why is this incorrect? Well, we know that heparin use in dialysis can slightly prolong clotting time, but it does not keep the blood anticoagulated for hours. And since protamine sulfate is used to reverse the heparin's effects, most patients regain normal clotting ability relatively quickly. And if clotting time were significantly extended, the patient would be at higher risk for post-hemodialysis bleeding complications, which is not a routine concern. Now, letter D, another incorrect option, it's because warfarin is not routinely given to dialysis patients for the same reason. And warfarin, we know, is used for long-term anticoagulations, for AFib, mechanical heart valves, or maybe DVT, but it's not given for routine hemodialysis anticoagulation. Now, I want you to remember that the goal of heparin use during dialysis is temporary clot prevention in the machine, not between sessions. And we're also not, the goal is not about anticoagulating the patient. So I want you to focus on the core purpose of heparin in the dialysis. The question basically is asking how to explain anticoagulation in the dialysis patients, not in general. And so the best answer should emphasize localized anticoagulation, and that's why we are selecting letter B. 4. A nurse is organizing care for a patient with pre-renal acute kidney injury after surgery to repair an abdominal aortic aneurysm. The patient has produced only 80 mL of urine over the past 5 hours, and their blood pressure is 90/56. What should the nurse include in the care plan? Options: A. Position the patient with their head lowered and feet elevated. B. Expect the urine-specific gravity to measure around 1.010. C. Arrange for an IV fluid bolus to address low volume. D. Get the patient ready for a CT scan using contrast dye. The answer is letter C. Now, in this scenario, we're dealing with a patient who is experiencing pre-renal acute kidney injury after they had a AAA surgery. So the nurse here needs to prioritize care that will address the underlying cause of the acute kidney injury, which is typically a result of the hypoperfusion or the low blood volume. And so the correct answer here is letter C. We're going to have to administer IV bolus to address the low volume, as we know that the patient is hypotensive at 90/56, and the urine output is only 80 mLs over the past 5 hours. This is hypovolemia. There's not enough blood flow to the kidneys. And take note that in pre-renal acute kidney injury, the kidneys are still working, but they're not getting enough blood and oxygen because of low blood volume or low blood pressure. And so the main treatment in this case is to restore the circulating volume by giving an IV bolus. And this will somehow improve the blood flow to the kidneys and also increase their urine output. And so the key signs that you need to pay attention here are the low blood pressure and the low urine output, which point to the problem. That's why we are going to do letter C. Now, what about letter A? Position the patient with their head lowered and feet elevated. This is the Trendelenburg position, putting the client with the head lowered, feet elevated. Well, this is once used for hypotension, but according to evidence-based practice, it is no longer considered a first-line treatment for hypovolemia-related low blood pressure. And the reason for that is because evidence suggests that this position does not significantly improve circulation, and this may even cause complications like increased pressure on the diaphragm, especially for those patients who have existing comorbidities, cardiovascular comorbidities or respiratory comorbidities, and so it's going to make their breathing more difficult. And so this is not our initial or best intervention. Now, what about letter B? Expect the urine specific gravity to measure around 1.010. Well, this is basically normal, and we know that in pre-renal acute kidney injury, we're going to expect the specific gravity to be higher, not lower. And again, in pre-renal acute kidney injury, the kidneys are trying to conserve water because they're not getting enough blood flow. And so the urine specific gravity tends to be higher, usually around 1.030 or greater. And so this means the urine is more concentrated as the kidneys are trying to hold on to the water. Now, letter D. Get the patient ready for a CT scan using contrast dye. Well, this option is inappropriate because the contrast dye can worsen the kidney function in patients with acute kidney injury, especially if the injury is pre-renal and caused by low blood volume or low perfusion. And the use of contrast dye in acute kidney injury should be avoided if possible, because this can lead to contrast-induced nephropathy, which will further damage the kidneys. And so the clue here in option D is using contrast dye. This is a red flag, and the nurse should avoid this type of procedure in patients with known acute kidney injury because of its nephrotoxic effects. And so when you answer this type of question, you have to always focus on the cause and treatment. Now, as we know that this is an acute kidney injury, we have to remind ourselves and remind yourself that the primary problem here is about hypoperfusion, which can often be treated with IV fluids to restore the fluid volume, and this will improve the kidney function. And so you have to look for the answers that address the volume status and the blood pressure. And you have to question those options that introduce interventions that could be potentially harming the patient or could worsen their condition. And so you got to pay attention to the clinical clues in the case as well. You have the low urine output and the low blood pressure. 5. Which of these abnormal blood test findings would remain uncorrected by dialysis treatment? Options: A, increased serum sodium levels; B, reduced hemoglobin levels; C, increased serum potassium; D, increased serum creatinine. The answer here is letter B, reduced hemoglobin, or letter C rather, increased. No, that's basically incorrect right there. I mistakenly put C. That is letter B, reduced hemoglobin levels. Let me correct that one. So that is option B, not C. All right. So the correct answer there is letter B, reduce hemoglobin levels. We know that dialysis is a great modality in removing the waste products and also balancing the electrolytes. But one thing it cannot fix is anemia. That is the low hemoglobin level. In fact, dialysis can make anemia worse because the process itself can cause some red blood cell destruction. And many dialysis patients already have anemia due to the chronic kidney disease, and their kidneys are not producing enough erythropoietin, which is that hormone that stimulates the red blood cell production. And that's why these patients often will need the erythropoiesis stimulating agents, or the like the Procrit or iron supplementation to treat their anemia. But dialysis alone will not correct this issue. Now, why is the letter A incorrect? Increased serum sodium levels. Well, we know that dialysis is designed to regulate electrolytes and their imbalances, and sodium is one of those electrolytes that is one of hypernatremia. The dialysis can remove the excess sodium. It will restore the normal levels. And even though the dialysis settings like sodium concentration and the dialysate, it must be carefully adjusted to prevent rapid shifting, which can cause complications such as the disequilibrium syndrome as well. Now, what about letter C? Increased serum potassium. Hyperkalemia, right? This is one of the most critical reasons dialysis is performed. And this is life-threatening because they can lead to fatal cardiac arrhythmias. And dialysis can effectively remove the excess potassium. This will prevent complications. And so unlike the anemia, hyperkalemia is something that dialysis can fix. Now, what about letter D? Increased serum creatinine. We know that this is the product of muscle metabolism, and healthy kidneys normally can filter this one out. But with a client that has renal failure, creatinine will start to build up in the blood, so dialysis is used to remove this byproduct. And while dialysis does not completely restore kidney function, it does significantly lower creatinine levels by removing it from the bloodstream. And so when you answer this type of question, you have to recognize that dialysis corrects metabolic imbalances. That includes the electrolyte counts, the waste products, but it does not fix blood-related issues like anemia. And so if you see an option related to red blood cells, that's a red flag, and that's likely the correct answer. 6. A nurse is providing discharge instructions to a patient who has spontaneously passed a calcium oxalate kidney stone. Which foods should the nurse advise the patient to avoid? Select all that apply. Options: A, whole grain products; B, leafy spinach; C, dark brewed tea; D, beef or pork; E, dairy cheese. The answers here are options B and C. Well, B is correct. It's because leafy spinach is high in oxalates, which are the compounds that can form calcium oxalate kidney stones. And since this patient has already passed calcium oxalate stone, it's very important for this patient to avoid those food items containing oxalates. And if they're going to consume this food item, this will increase their risk of forming more stones. Now, what about C, dark brewed tea? We're talking about varieties like black tea. This is considered to contain high oxalates, just like spinach. And again, this can contribute to the formation of calcium oxalate stones and should be avoided by the client as well. Now, what about letter A, whole grain products? These are generally not a concern for calcium oxalate stones. The whole grain products contain struvite, which are magnesium ammonium phosphate, and also unrelated to calcium oxalate stone. Now, letter D, beef or pork. This is also incorrect because these two do not contain oxalates and are generally safe to eat for someone who has a history of calcium oxalate stones. However, though, the beef or pork contain struvite, which is not a concern for this particular patient. Now, letter E, dairy cheese, is also incorrect. This can also contain struvite, but not oxalate. And so the issue is calcium oxalate stone, and so this is not a food item that the client should avoid. So the effective strategy for you to answer this question is to focus on the specific type of stone the patient has passed, which is in the case the calcium oxalate. And you got to eliminate those food choices that are unrelated to calcium oxalate stones. And you got to look for terms like struvite, associated foods that are high in struvite, which will immediately signal you that the food is not relevant for a calcium oxalate stone patient. 7. As a client undergoing hemodialysis prepares to leave the dialysis facility for home, what discharge teaching should the nurse provide? Options: A, use eyes on the access site if bleeding occurs at home. B, maintain short fingernails and avoid scratching your skin. C, tell your partner to take charge of your decisions. D, contact your healthcare provider if your oral temperature reaches 102 degrees Fahrenheit or higher. The answer here is letter B. Why is that? Well, many dialysis patients will experience, or they're experiencing, itching due to the uremic frost, which happens when the waste products like urea can crystallize on their skin because the kidneys are not filtering properly. And so scratching can easily lead to skin breakdown, infections, or even cellulitis, which is especially concerning since dialysis patients already have a weakened immune system. And that's why keeping nails short and avoiding scratching is very important for their skincare to prevent infection. Now, why are letters A, C, and D incorrect? We have letter A. The application of ice to the access site if it bleeds cannot stop the bleeding. However, it can actually reduce the blood flow and it will interfere with clot formation. And so what the person should do when this happens at home is to apply firm pressure to the site. Now, if the bleeding does not stop after a few minutes, the client should call for immediate medical attention because we don't want excessive bleeding from a dialysis access site. This is a high pressure blood vessel. Now, what about letter C? Tell your partner to take charge of your decisions. Well, clients should be empowered to manage their own care and make informed decisions while they have a support system. This is very important. The nurse should never encourage dependence on others for decision making if the client is still able to do it themselves. And so the client needs to be educated on their condition, their treatment, and when to ask for help so they can maintain control over their health. Now, what about letter D? This temperature elevation of 102 degrees Fahrenheit. Well, it states that to contact your healthcare provider if your oral temperature reaches 102. Well, basically, this is just waiting for a temperature of 102, and this is risky. And because patients can develop high temperatures even at 100 or 101, and so even if they have a temperature reading of 100 degrees Celsius or 100 degrees Fahrenheit or 37.8 degrees Celsius, they should immediately report this to the medical provider so treatment can start before an infection can worsen. And so for this test question, think about prevention and early intervention, and the best answer should involve preventing complications rather than just reacting to this complications. And so the better option, or the best option that we have here, is to select B, maintain short fingernails and avoiding scratching your skin. 8. A nurse has completed educating a patient who is about to undergo extracorporeal shock wave lithotripsy, or ESWL. Which statement from the patient shows they have grasped the information provided? Options: I should let my doctor know if I notice any bruising afterward. B, it's important to filter my urine after the treatment. C, this procedure will lower my risk of getting stones again. D, I'll be completely alert throughout the entire process. Now, the key to this question is to understand the purpose of the post-procedure care for a patient undergoing the ESWL, which is the treatment to break the kidney stones into smaller pieces so the client can pass them more easily. And so the correct answer here is letter B. All right. It states, it's important to filter my urine after the treatment. And this is important because the kidney stones are broken into smaller fragments, and we are going to encourage the client to strain their urine to capture and also to confirm that all stone pieces are being expelled. And so this step will ensure that the stones are being eliminated from their renal system, and this will also help the healthcare team monitor the progress. And so the clue here, filter my urine, is directly referring to the straining and the monitoring for the stone fragments, and that's why this is the closest answer. Now, why is letter A incorrect? I should let my doctor know if I notice any bruising afterward. Well, it's because bruising can occur after the procedure, and this is an expected side effect of the procedure, and the shock waves can cause this some bruising or soreness in the area where the waves were directed. And so this is something that does not warrant notification to the medical provider unless it becomes severe or there are signs of any complications. All right. Again, this is an expected finding. Letter C is also incorrect. It states this procedure will lower my risk of getting stones again. And this statement is incorrect is because the treatment for existing kidney stones, this is the ESWL is a treatment of existing kidney stones, not a preventive measure. And so we know that the procedure breaks the stones into smaller fragments so the patient can pass them more easily. But after the ESWL, patients still need to manage their risk factors. They need to increase their fluid intake. They have to modify their diet and possibly they're going to have to take some medications to reduce their likelihood of developing those stones again. And so the clue here is lower my risk of getting stones again, which is misleading because the procedure does not address the prevention of new stones, just the existing ones. Now, letter D is also incorrect. It states, I'll be completely alert throughout the entire process, because ESWL typically is performed under moderate sedation. Even though the patient might be awake, they won't be fully alert or conscious during the procedure. And this is to ensure the patient is comfortable and does not feel pain during the shock waves. And so the clue in this option, completely alert throughout the process, which is not accurate about this procedure. So your strategy in answering this test question is to focus on the specific post-procedure care instructions. And our option here is to do letter B. They have to do this immediately after a procedure to ensure the desired outcome the outcome is being met, and also to avoid complications. And so the straining of the urine is part of the monitoring process after the procedure to check if they are still passing through these, they're passing the fragments of these stones. 9. When a patient arrives at the healthcare facility experiencing an acute rejection of their transplanted kidney, what action will the nurse anticipate undertaking for this individual? Options: A, preparing to give medications that suppress the immune system. B, arranging the patient to be added to the list for a new organ transplant. C, performing an assessment to check compatibility with human leukocyte antigen. D, setting up an arteriovenous shunt for dialysis treatment. So when you encounter this kind of question, the key here is to focus on the concept of acute rejection after a kidney transplant, which involves the immune system attacking the transplanted organ. And so the correct answer here is letter A. Why? Well, it's because when a patient is experiencing the acute rejection of the newly transplanted kidney, the primary goal is to treat the immune response that's attacking the organ. And we know that the rejection is due to the body's immune system recognizing the transplanted kidney as foreign. And so the body is triggering an immune response. And to manage this, the nurse should anticipate administering immunosuppressive medications to suppress the immune system and to prevent further rejection. And so in this kind of scenario, expect that the immunosuppression will involve the use of corticosteroids, which are commonly used in transplant patients during the acute rejection episodes, so to reduce the inflammation and also to reduce the immune activity. All right. Now, what about letter B? Why is this incorrect? Arranging the patient to be added to the list for a new organ transplant. Well, this is incorrect because the acute rejection is typically reversible with prompt treatment. Now, the keywords here are prompt treatment. There's no immediate need to consider replacing the transplanted organ unless the rejection is severe and unresponsive to immunosuppressive therapy. And you have to really consider looking into the into managing the rejection with anticipating the treatment, which is immunosuppressive therapy. Now, what about letter C? Performing an assessment to check compatibility with human leukocyte antigen. Why is this incorrect? Well, HLA compatibility testing is done before the transplant, not after. And this is done to ensure that the donor kidney matches the recipient's immune system. And once a transplant is in place and if rejection is suspected, the focus is on treating the rejection rather than retesting for HLA compatibility. All right. And so again, HLA is supposed to be done before the transplantation, not after. Letter D is also incorrect because dialysis is not the first line response to an episode of acute transplant rejection. Even though dialysis may be required if kidney function starts to deteriorate to the point the organ fails, but in the case of acute rejection, the priority is to attempt to reverse the rejection with immunosuppressive therapy. Okay? And so the dialysis treatment in option D is a secondary measure if the transplant is unsuccessful, but this is not going to be done as an immediate action for acute rejection. And so when you encounter this type of question related to organ transplantation, you have to differentiate between acute and chronic rejection. And so in such cases about acute rejection, the focus is on immunosuppressive therapy, and this is to manage the immune response, while chronic rejection may lead to, let's say, discussions about retransplantation or the use of dialysis. And if the question hints at a sudden onset or acute rejection, your responsibility is to prioritize to treat the immune response first. Okay? And you have to pay close attention to the timing of the issue. That's why I want you to differentiate between acute and chronic. And you have to focus on the treatments that directly address the immediate cause. 10. For a client diagnosed with chronic kidney disease and scheduled to undergo hemodialysis on Tuesdays, Thursdays, and Saturdays, which measures should the dialysis nurse formally implement? Select all that apply. Options. A. Engage the client in friendly dialogue throughout the dialysis sessions. B. Continuously monitor the hemodialysis access site during the procedure. C. Measure the client's body weight before and after each treatment. D. Provide the client with sodium-rich refreshments such as potato chips or pretzels. E. Review the prescribed fluid intake limitations with the client. The answers here are options B, C, and E. So the best approach to hemodialysis care is prioritizing safety, fluid management, and patient education. And that is why B, C, and E are the correct choices. Now, what about letter B? Continuously monitor hemodialysis access site during the procedure. Well, we know that the procedure involves the removal and returning of the entire blood volume. And so if there is any disconnection or malfunction at the access site, which could cause severe blood loss within seconds, that is why you as a nurse should monitor the site closely throughout the treatment to prevent potential hemorrhage or clotting of the access. C is correct. We know that weight changes directly reflect fluid balance in the dialysis patients, and that's why pre-dialysis weight is going to be obtained, because this is going to determine how much fluid needs to be removed, while after the dialysis we're going to have to obtain another set of weight so to confirm whether the session of dialysis was effective. And this is one of the most critical assessments to monitor fluid overload, or let's say the client has been dehydrated. Letter E is also a good option because we know that in chronic renal failure, the kidneys cannot effectively regulate the fluid, so making fluid restrictions very necessary to prevent fluid overload, to prevent hypertension, and also to prevent pulmonary edema. So your role is to educate the patient about sticking to their fluid allowance, which is very critical part of their self-management and their cardiovascular health. Now, why is letter A Incorrect. We know that this might seem a little bit helpful, but many dialysis patients prefer to rest, sleep during the session, or maybe read or watch TV during the dialysis session. And also, engaging them in a conversation can be physically draining as well. And take note that the sessions that they're going to undergo often last for several hours, and patients will feel very fatigued or uncomfortable, so they need time to relax and also recharge. Now, what about letter D? Why is this incorrect? Well, we know that's really high sodium, right? This can worsen their fluid retention, and this is going to make harder for the dialysis to remove the excess fluid. And again, clients should avoid ingesting this high sodium snacks. Let's have number 11. Which detail from the health history of an elderly patient prescribed cyclosporine after a kidney transplant should the nurse consider when preparing to educate the patient about this medication? Options: A, the patient consumes 3 to 4 quarts of fluid per day. B, the patient limits sodium intake to 2 grams each day. C, the patient regularly drink grapefruit juice. D, the patient includes green leafy vegetables in their daily diet. The answer here is letter C. Why is that? It's because grapefruit juice is known to interact with several medications, including cyclosporine. And the reason for that is because the grapefruit juice can increase the blood levels of the medication, so it will result into toxicity. Okay, and why is this happening? Well, because the grapefruit will inhibit the liver enzymes which are responsible for metabolizing cyclosporine. And again, like I've said, grapefruit juice can increase the concentration of the cyclosporine in the bloodstream. This will lead to side effects or toxic effects, which will result in kidney damage. Now, why is letter A incorrect? The patient consumes 3 to 4 quarts of fluid per day. Well, the reason for that is because fluid this much, okay, 3 to 4 quarts daily, that's about 2.8 to 3.7 liters, does not directly affect the cyclosporine levels for its effectiveness. We know that maintaining adequate hydration is important for kidney function. And this fluid intake is not a risk, or it does not require adjustment of the cyclosporine therapy. Letter B is also incorrect. This answer is this option is basically limiting the sodium, right? 2 grams each day. So this is a good practice for the general health, particularly for those with kidney disease, but this doesn't directly impact the metabolism or efficacy of the cyclosporine. And sodium restriction can help in managing the client's fluid balance and their blood pressure, but will not interfere with the cyclosporine action. Letter D is also incorrect. It's because eating green leafy vegetables does not really interact with the cyclosporine therapy, unlike vegetables, green leafy vegetables interacting with the coumadin or warfarin, and it doesn't work that way. And so we are going to eliminate option D as well. And so with this type of question, I want you to be on the lookout for specific drug interactions that can affect the client's safety or efficacy of the medication. And so again, grapefruit can increase the levels of the cyclosporine in the bloodstream. 12. A client with renal insufficiency presenting for outpatient hemodialysis exhibits unresponsiveness to inquiries and diminished deep tendon reflexes. The client's family indicates that the individual has been using an aluminum hydroxide and magnesium hydroxide suspension, Maalox, at home to alleviate dyspepsia. What initial step should the nurse undertake? Options. A. Examine the client's most recent magnesium level recorded in the medical chart. B. Alert the client's healthcare provider promptly. C. Educate the client regarding the hazards of antacids containing magnesium. D. Request authorization to assess the client's potassium concentration. The answer is letter B. Why is that? It's because the client here is already showing signs of hypermagnesemia. The client is already unresponsive. It's already affecting their neural function. There's also diminished deep tendon reflexes. This is magnesium toxicity. All right. And since the client here has kidney insufficiency, the body is not able to excrete the magnesium. And if they're taking those magnesium containing antacids, this is causing toxic levels of the medication. And this is a life-threatening scenario. Because this can also affect their respiratory function. This can lead to respiratory depression. This can cause hypotension and even cardiac arrest. So your priority is to notify the healthcare provider immediately in order for us to reverse the issue. Maybe we're going to get an order for a calcium gluconate to counteract the magnesium's effects. And also possibly we might end up with doing emergency dialysis for this patient. And that's why prompt notification is critical at this point. Again, the client is already manifesting toxic signs and symptoms to the magnesium. Now, what about letters A, C, and D? Examine the client's most recent magnesium level recorded in the medical chart. We know that this is important, right? But the priority for this patient is safety, okay? If you're going to delay notification this time, this could waste valuable time. So you have to do letter B first. Now, why is C incorrect? We know that education is very important to preventing future occurrences such as this one. But right now, the client is symptomatic, right? Unconscious. And the teaching should happen after the immediate medical emergency has been addressed. Now, letter D is also incorrect. Request authorization to assess the client's potassium concentration. Well, we know that potassium is another key electrolyte to monitor in renal failure, but the client's symptoms, such as the unconsciousness, there's decreased reflexes, do not match potassium or hyperkalemia. Instead, the manifestations are pointing to hypermagnesemia. And so checking the magnesium would not be the most urgent step this time. So for this test question, this is basically a prioritization about life-threatening condition. You have to prioritize the client's safety, airway, breathing, and circulation. And we need to act on this right away by notifying the medical provider in order for us to obtain those orders to reverse the magnesium toxicity. Okay, again, we're going to have to obtain those medical orders, such as possible calcium gluconate administration and possible immediate hemodialysis to remove the excess serum magnesium in their body. All right. 13. Which statement made by a patient during a nurse-led discussion on medication therapy after a kidney transplant indicates a need for further instruction? Options. A. If my body starts rejecting the kidney, I'll need extra meds. B. After a few years, I think I can stop taking cyclosporine. C. I need to be watched closely for signs of cancer. D. The drugs work together to stop my kidney from being rejected in different ways. The answer here is letter B. And why is that? Well, because the statement reflects a misunderstanding about their lifelong therapy. And we know that the client has had a kidney transplant, and cyclosporine is an immunosuppressant, and this is going to be taken lifelong to prevent organ rejection after the procedure. And so this is not something that can be stopped after a few years, because it is needed to prevent immune system from attacking the transplanted kidney for the patient's lifetime. And so your role here as a nurse should clarify to the patient that lifelong immunosuppression is critical to prevent organ rejection. Now, what about letter A? It states, if my body starts rejecting the kidney, I'll need extra meds. Well, this statement is accurate if a patient experiences acute rejection. They will require additional medications, maybe steroids or other immunosuppressive drugs in order to manage the rejection episode. And we know that this is going to be a serious concern after a kidney transplant. And so the patient's understanding here is correct. So we're eliminating this one. Now, what about letter C? I need to be watched closely for signs of cancer. Now, going back into the medication here, this is a scenario about a kidney transplant, right? And so remember about the cyclosporine, which is the immunosuppressive medication that is going to be used for this procedure. Cyclosporine is known to increase the client's risk of developing cancer, particularly skin cancers or lymphomas. It's because of their effects on the immune system. And so the client who has had the kidney transplant with the immunosuppressive medication should be monitored for these malignancies. So this statement is accurate. Now, what about letter D? The drugs work together to stop my kidney from being rejected in different ways. This statement is also accurate, right? This shows how immunosuppressive medications like cyclosporine work in tandem with the other medications such as steroids and mycophenolate, which is another immunosuppressive medication, in order to prevent organ rejection. And so these medications are used together to have that synergistic effect and to suppress the different parts of the immune response, which is a critical concept in transplant medicine. And so the clue in this option is work together. Drugs work together. This is indicating the patient is understanding the multi-drug regimen in order to prevent the drug rejection. 14. Which selection from the menu by a client undergoing hemodialysis demonstrates that the nurse's educational efforts have been effective? Options: A, cheese sandwich accompanied by tomato soup and cranberry juice. B, poached eggs served with whole wheat toast and apple juice. C, split pea soup paired with an English muffin and non-fat milk. D, oatmeal prepared with cream, half a banana, and herbal tea. So the answer here is letter B, poached eggs served with whole wheat toast and apple juice. Why is this correct? Well, we know that patients who are undergoing dialysis, they're basically going to manage their intake of potassium, sodium, phosphate, and this is something that they need to be compliant about because their body or their kidneys are not able to effectively filter these excess in electrolytes. And so the poached eggs served here will provide the client high quality protein, which is very important because hemodialysis can cause protein loss. And the apple juice in this option is a low potassium beverage, so this is also a safe choice. And the whole wheat toast is also an acceptable moderation because it provides fiber without excessive potassium or phosphorus. Now, what about letter A? Cheese sandwich accompanied by tomato soup and cranberry juice. And so be mindful here that cheese is loaded with sodium. It also has phosphate. And this should be eliminated in dialysis patients due to their chances of fluid retention and also their bone disease. And the tomato soup in option A is also high in potassium, which can lead to hyperkalemia, and this can cause heart rhythm disturbances as well if not regulated. And we have letter C, split pea soup paired with an English muffin and non-fat milk. And so with a split pea soup, this is a no-go because legumes contain lots of potassium. And the non-fat milk is also high in phosphate, which can contribute to bone disease in dialysis patients. Now, with oatmeal prepared with cream in option D, we know that we also have a banana, herbal tea. So take a look into the banana here. This is rich in potassium. And this is something that should be avoided. And the cream in the oatmeal prepared with cream is also high in phosphate, which can worsen chronic kidney disease complications. And so for you to answer this question, you have to eliminate those options with high potassium. So we have the bananas, we have that tomato soup, and the split pea soup. And you also have to avoid those high phosphate containing food items. We have cheese, milk, cream. And for you to choose the best diet, you have to select high quality protein like eggs, and also prioritize kidney friendly, low potassium and low phosphate foods to ensure adequate protein intake on this client. 15. Which medication should the nurse hesitate to administer to a patient who has undergone a kidney transplant and is receiving cyclosporine therapy? Option A, acetaminophen, B, prochlorperazine, C, trimethoprim sulfamethoxazole, D, captopril. The answer here is letter C. So that's the TMP-ASMZ, trimethoprim sulfamethoxazole. This is what we have as Bactrim DS. This is an antimicrobial agent that is used for urinary tract infection. But you have to go back into the question stem here. The client had a kidney transplant and receives cyclosporine therapy. Now, I want you to think about the interaction between the TMP-SMZ and the cyclosporine. And the medication here, the TMP-SMZ, can diminish the effectiveness of the cyclosporine. This will reduce the concentration of the medication in the blood. And we know that cyclosporine is very critical in maintaining or also to prevent rejection of the newly transplanted kidney. So we don't want rejection for this patient. So that is our best answer. Letter A, acetaminophen, which is basically Tylenol. This is commonly used medication for pain control, especially for mild pain, but it does not pose any contraindication for those patients taking cyclosporine. And this is also a safe choice for pain management, especially if they had the kidney transplant. Now, letter B, prochlorperazine, which is Compazine. This is an anti-nausea medication. It does not present any contraindication for kidney transplant patients. But you got to be cautious though, especially if the patient may have an existing liver condition. For letter D, captopril, which is an ACE inhibitor. This is something that a patient may use for hypertension. But for the patient who has kidney transplant and using cyclosporine, there's no known interaction between the two. Okay, and so we are going to eliminate captopril as well. 16. When preparing a client for hemodialysis requiring vascular access, which statement by the nurse correctly identifies a benefit of employing a fistula rather than a graft? Options: A fistula permits the use of larger caliber needles during the procedure. B, a fistula significantly reduces the likelihood of thrombus formation. C, a fistula enhances the client's range of physical movement. D, a fistula may be utilized more promptly following its surgical creation. The answer here is letter B. Why is this a correct option? Well, we know that with the arteriovenous fistula, this is the preferred vascular access for long-term hemodialysis because it has lower risk of clot formation compared to an arteriovenous graft. And this is due to its natural connection between an artery and a vein, which will allow for better blood flow and less risk of foreign material triggering clotting as compared to those clients using synthetic grafts. And so the fistula can take several weeks to mature, about 2 to 3 months, but the long-term benefits make it the best option when feasible. Now, what about letter A? Why is this incorrect? This states a fistula permits the use of larger caliber needles during the procedure. Well, the size of needles used for hemodialysis is not determined by the type of vascular access. The needle gauge depends more on the blood flow needs and the individual patient factors. So this is incorrect. Now, why is letter C incorrect as well? It's because mobility is not significantly different between a fistula and a graft, and patients with either axis are still advised to avoid excessive pressure. They need to avoid excessive heavy lifting and also avoid sleeping on the axis arms to prevent complications. Letter D is also incorrect because a fistula takes longer to mature. Again, that's going to take about 6 to 12 weeks before it can be used, whereas an AV graft can be used within 2 to 3 weeks. And if a patient requires urgent dialysis, they're going to have a temporary central venous catheter while waiting for the permanent access to mature. And so if you're going to encounter the same type of question like this one, especially with fistula, or let's say comparison between a fistula and a graft, you need to focus on long-term advantages like lower clot risk and also better durability. Okay, and you got to eliminate those options that do not directly compare a fistula to a graft, like needle size or mobility. 17. Which measures should the nurse execute for a patient diagnosed with suspected renal calculi who is scheduled to undergo an intravenous spielogram with dye? Select all that apply. Options: A, ensure an 18-gauge angiocatheter is placed. B, verify the patient's creatinine concentration. C, maintain the patient on NPO status. D, secure informed consent from the patient. E, evaluate the patient for a potential allergy to iodine. Well, the correct answers here are options B, D, and E. So, why B? We know that this is a procedure that involves the injection of a dye, right? So, your role is to check the patient's serum creatinine levels because the contrast dye can be toxic on the kidneys. And if the patient's kidney function is already compromised, the dye may make the situation worse. And so you got to make sure that you have looked into the creatinine levels to ensure that the client's safety is maintained. Okay. And if the client maybe has some slight elevation in their creatinine levels, you have to notify the medical provider so to anticipate interventions to diminish the harm on their kidneys. Letter D, why is this correct? Of course, this is an intravenous procedure and an invasive procedure. So the patient needs to understand what will happen. They need to know the risks involved and what alternatives that are available. And so the nurse must ensure the patient has been fully informed, and then we're going to have to secure that consent before proceeding to the diagnostic test. And we know that this is a legal and ethical requirement for any invasive medical procedure. Letter E, why is this correct? Evaluate the patient for a potential allergy to iodine. Now, we know that the contrast agent contains iodine, so it's important to check if the patient is allergic to this substance before administering this. And the best way to do this is to ask the client directly if they had any prior reactions to products like betadine or shellfish. And if we fail to do this action, this can lead to possible severe reactions, anaphylaxis. And so this is going to be another good intervention. All right, so why is letter A incorrect? Ensure an 18-gauge angiocatheter is placed. We know that the venous catheter is required during the IVP, but there is no universal rule that the catheter must be specifically 18-gauge, all right? And so the size of the catheter typically depends on the institutional protocol or the patient's vein size. So there is no specific gauge that is going to be required for this procedure. All right. Letter C, maintain the patient on NPO status. Well, typically the NPO is going to be required for procedures involving general anesthesia or, let's say, sedation. But for this IVP, it's not always necessary unless there is specific procedure guidelines or if this is a protocol. And so the client may be allowed to eat or drink up until a certain point before the procedure. So it depends on the protocol. And so the key clue is here. Unless there's additional institutional or procedural guidelines, which tells us that this step is not universally required and it depends on the specific circumstances. And so for you to answer this question, you have to look for the safety related and essential action that are directly linked to the procedure in this question, the IVP. Okay, so you have to distinguish between a standard requirement versus optional or situational requirements like catheter size or the NPO. So your strategy is to eliminate those options that do not directly impact the patient's safety or the specific procedure. 18. While a client undergoes standard hemodialysis and reports feelings of nausea and lightheadedness, what initial measure should the nurse undertake? Options. A. Administer antiemetic medication prescribed for as needed use. B. Assess the client's blood pressure. C. Decrease the dialysis flow rate. D. Evaluate the client's hematocrit value. The answer here is letter B. This is the initial action. And so when a client undergoes hemodialysis and immediately when they report these manifestations, these are basically symptoms of classic dialysis-induced hypotension, which can occur because of fluid removal that has been done too quickly or maybe there is intravascular or vascular instability. So your first action is to check the blood pressure immediately to confirm if the hypotension is the cause. Now, if the low blood pressure is detected, then you're going to have to act on appropriate nursing actions, right? You're probably going to need to do fluid bolus or to reduce the ultrafiltration during the dialysis. And so that's why we're going to do letter B first thing. Okay, you do your assessment. Now, why is letter A incorrect? Administer antiemetic medication, prescribed PRN. We know that nausea is a symptom. And so giving an antiemetic does not address the root cause of the dizziness, right? And so if hypotension is causing the nausea, you need to treat the underlying blood pressure issue. That is your priority before you give the antiemetics. Letter C, decrease the dialysis flow rate. We know that slowing the dialysis rate may be important if the hypotension is confirmed, but you got to do your blood pressure check first, okay? So if you're going to do the changing of the dialysis settings without confirming the blood pressure first, this could delay the proper intervention, and this will lead to unnecessary adjustments in the dialysis. Letter D is also incorrect. It states evaluate the client's hematocrit value. And we know that a low hematocrit could contribute to the chronic fatigue or the anemia related to the dizziness, but it does not explain the acute onset of the nausea and the lightheadedness during the dialysis. Okay, and so this is quite a sudden change rather in this situation. Okay, so this was not pre-existing before the client before the dialysis was started, and so this is a change in the client's condition. So what you do first is to check the blood pressure to determine if hypotension is the cause. Alrighty, let's have number 19. What should the nurse do for a patient with kidney stones in the surgical unit who's using a morphine PCA pump? Select all that apply. Options. A, advise the patient to seek assistance prior to rising from the bed. B, assure the patient that the medication will completely eliminate all pain. C, direct the patient to activate the control button whenever a pain relief is desired. D, instruct the unlicensed assistive personnel to filter all of the patient's urine. And E, explain that the efficacy of the medication will be assessed using a pain scale ranging from 1 to 10. The answers here are letters A, C, D, and E. So A is correct. It's because when a patient is on the PCA morphine pump, they are at risk for the side effects like sedation, dizziness, which can impair their balance and coordination, and allowing them to independently ambulate can lead to falls. So it's important for the nurse to advise the patient to ask for help before trying to get out of bed and to ambulate. Now, letter C is also correct. This is one of the benefits of the patient-controlled analgesia because it allows the patient to manage their own pain by pressing the control button if their pain is getting bad, right? And so the device is pre-programmed with a lockout feature to prevent overdosing, to ensure the patient can safely control their pain by activating the button when they are needing the pain med. Letter D is also correct, especially in patients with kidney stones. It's essential that they're going to strain the urine to monitor for the passage of the renal calculi. And this is something that the UAP can do to capture those stones that may be passed by the patient. So this can be sent to the lab for analysis. Letter E is also correct. it says, explain that the efficacy of the medication will be assessed using a pain scale ranging from 1 to 10. This is most common standardized method of assessment of the pain. And also this will allows the nurse to gauge how effective the PCA morphine is in managing their pain. And to tell you, this is a case of kidney stones. The pain is excruciatingly painful. So the PCA pump basically will just kind of mitigate. It does not completely remove the pain, but this will somehow get the it will control, it will relieve the pain sensation, but not completely take the pain away. Now, what about letter B? Assure that the patient that the medication will completely eliminate all the pain. So this is what I just said. And again, the goal of the PCA morphine is to provide adequate pain control rather than eliminating the pain entirely. There's going to be still some discomfort that may persist depending on the condition severity. And so the phrase in letter B, will completely eliminate all pain, is misleading. This is incorrect. All right. So for you to answer this question, you are going to identify practical patient-centered actions that are safe, effective, and also aligned with the use of the PCA pump, and also with the case that we have, the kidney stones. And always remember, it's not about eliminating all pain, but about managing it appropriately, and also consider the device's limitations and the patient's safety. 20. When a client undergoing hemodialysis reports discomfort from leg cramps, what action should the nurse take? Options: A, administer acetaminophen to alleviate the discomfort. B, administer a bolus of normal saline IV. C, gently rub the client's legs to ease the cramping. D, adjust the client's position to lie flat on their back. The answer is letter B, administer a bolus of normal saline IV. Now go back into the case. It states leg cramps. The patient is reporting discomfort from leg cramps. So when this happens during the dialysis, this is happening due to the rapid removal of the fluids, rapid removal of the electrolytes, specifically sodium. And this sudden shift can lead to hypovolemia and muscle irritability. And so selecting letter B will help restore the intravascular volume and also sodium balance. This will alleviate the cramping. So this is basically a direct intervention to treat the underlying cause of the discomfort rather than just addressing the symptoms. Now, why is letter A incorrect? We know that this is an analgesic that can help with the pain relief, but Tylenol does not address the fluid and electrolyte imbalance, which is the cause of the cramping. So this is not our answer. Letter C is also incorrect. We know that massage may provide temporary relief by increasing blood circulation, also relaxing the muscles, but this does not correct the underlying cause, which is the depletion of the fluid and the sodium. And the cramping will likely persist unless the volume deficit is corrected. Now, what about letter D? Adjust the client's position to lie flat on their back. Well, this does not address the root cause of the cramps as well. We know that positioning can sometimes help with circulatory issues, but it does not correct the electrolyte imbalance or fluid loss that is causing the cramping. 21. Which measure should the nurse address with a patient diagnosed with calcium oxalate renal calculi who has been prescribed a thiazide diuretic? Select all that apply. Options: A, advise the patient to monitor blood pressure on a daily basis. B, encourage the patient to increase fluid consumption. C, clarify the necessity of daily potassium level assessments. D, educate the patient about the potential for kidney stone development associated with this diuretic. E, direct the patient to administer the diuretic during the morning hours. So, the case talks about a client who has calcium oxalate kidney stones and has a prescription for a thiazide. So the answers here are options B and E. Why B? We know that fluid intake is very important for anyone who has kidney stones, including those with calcium oxalate stones. And take note that the thiazide diuretics can concentrate the urine by decreasing calcium excretion, and maintaining the adequate hydration can help dilute the urine. This will reduce the risk of stone formation. And so when the client is taking a thiazide diuretic, they should increase their intake of water to prevent dehydration, which can otherwise lead to stone formation. Letter E is also correct. We know that thiazide diuretics are often prescribed in the morning, and this is done to prevent nocturia, and also will help reduce the risk of sleep disturbances. And the clue here in this option, during the morning hours. So this points to the timing of the medication to ensure better sleep and more effective treatment. Now, why is letter A incorrect? Advise the patient to monitor blood pressure on a daily basis. We know that thiazides can help manage hypertension, right? But daily blood pressure monitoring is usually unnecessary unless a specific issue requires it, okay? And so most patients taking these medications do not need to check their blood pressure daily, all right? Now, what about letter C? Clarify the necessity of daily potassium level assessments. Well, periodic potassium monitoring is generally important for patients in loop diuretics, which are known to cause significant potassium loss. And with thiazides, this can also lower the potassium levels, but daily monitoring is usually not required unless the patient has additional risk factors, such as renal impairment or taking other medications that also affect the potassium. And so, again, the clue in this option is daily potassium level assessment, which is unnecessary for most patients taking thiazide diuretics. Letter D is also incorrect. This is misleading. We know that thiazide diuretics are typically used to reduce the formation of kidney stones, particularly those caused by calcium. And they help prevent kidney stones by reducing calcium excretion in the urine. And it will increase calcium reabsorption into the bone. So this statement is not relevant unless discussing rare adverse effects. And the key clue in this option is kidney stone development associated with this diuretic, which is inaccurate because thiazide diuretics actually help prevent kidney stones. Now, your strategy in answering this question is to identify the interventions that directly address the disease process and the medication's effects. And you gotta go back into reviewing the drug's mechanism of action, then focus on the common side effects and the management strategy. So you have to eliminate those options that do not align with the patient's condition or the medication's purpose. So you got to be cautious about those options that reference rare or less common side effects unless the patient has additional risk factors, but those are not mentioned in this case. 22. A 40-year-old male admitted to the intensive care unit and undergoing hemodialysis for the past 6 months has not complied to his prescribed dietary and fluid limitations. Laboratory results reveal potassium 6.4 milliequivalents per liter, blood urea nitrogen 40, and creatinine 3.4 milligrams per dl. He also reports profound exhaustion and weakness. What is the most effective step for the nurse to undertake to address the client's lack of compliance? Options: A. Inquire whether the client desires consideration for a kidney transplant waiting list. B. Arrange for a consultation with a nutritionist to provide dietary guidance. C. Confer with the client's spouse regarding his medical condition. D. Inform the client that his failure to comply elevates his stroke risk. The answer is letter B. Well, why is this correct? Well, non-compliance with dietary restrictions, fluid restrictions is a common issue among hemodialysis patients. And it's not always about intentional disregard for medical advice, but many patients lack the understanding of the renal diet limitations, and also they struggle with food choices, or they may face some difficulties incorporating these changes into their lifestyle. And so a nutritionist really will have that role, critical role in assessing the knowledge gaps, and they can also provide education, and they can collaboratively work with the patient, also to develop a realistic and more sustainable diet plan. And so by addressing why the client is non-compliant, rather than just stating the consequences, and so this intervention promotes much more of a long-term adherence rather than short-term compliance driven by fear or maybe guilt. And so this is our best option. Now, why is letter A incorrect? It states inquire whether the client desires consideration for a kidney transplant waiting list. Well, this is a long-term solution, and it does not directly address the immediate concern of dietary non-compliance. And take note that not all dialysis patients are eligible for transplantation. And this is a conversation that's better suited for the nephrologist rather than a bedside nurse. Letter C is also incorrect. Confer with the client's spouse regarding his medical condition. Well, according to HIPAA, the regulation prohibits disclosing medical information without patient consent, even if the spouse is involved in meal preparation. The client must first agree to include them in the discussion. And so the best approach is to engage the patient first and then involve the family only if they consent. Letter D is also incorrect. We know that hyperkalemia and poor dialysis adherence can increase the risk of stroke and also cardiovascular complications. But if you are using fear-based motivation, that's going to be ineffective. And research indicates that educating and involving the patient in their care is much more successful in promoting compliance rather than scaring them with telling them about their stroke risk. And so with this type of question, especially that the client has non-compliance, do not just focus on the consequences. You have to focus on the solution. And you have to keep in mind to avoid fear-based or punitive approaches such as scolding or threatening outcomes that they're going to end up with stroke. And also remind yourself that education is often the best intervention, and it should be tailored. It should involve the client in order to gain collaboration. All right. And when in doubt, always go for the interventions that engage and educate the patient rather than ones that simply inform or just simply warning or referring. So eliminate those options. 23. Which statement by a patient diagnosed with renal calculi who has been prescribed allopurinol for uric acid stone management necessitates action by the nurse? Options: A, I abstain from consuming wine or any alcoholic beverages. B, I drink at least 8 glasses of water each day. C, due to joint discomfort, I occasionally take a few aspirin tablets. D, I require 2 acetaminophen tablets to alleviate my headache. The answer here is letter C. Why is that correct? We know that aspirin, or the salicylate acid, can increase the urinary acidity, which is counterproductive for this patient with the uric acid stone. So the goal for this patient is to maintain an alkaline urine to prevent further stone formation. And so the clue is aspirin tablets. Okay, they are the cause of the problem in this scenario. So that would be the best option here. The question basically is asking for the nurse to intervene. All right. Now, what about letter A? I abstain from consuming wine or any alcoholic beverages. Avoiding high purine foods like wine and alcohol is actually beneficial for patients with uric acid stones because it helps maintain an alkaline urine. And letter B, I drink at least 8 glasses of water each day, is very important. We know that hydration can be beneficial to prevent drug buildup and stone formation. And this statement shows the patient is following the proper hydration practices, so there's no action required in the statement. Letter D is also incorrect. Acetaminophen is a safe pain reliever for the patient having renal calculi because it does not affect the urinary acidity like aspirin does. And when you're going to encounter the same type of question, you have to focus on identifying medications that could have an adverse effect on the patient's condition, such as the aspirin in the case of uric acid stones. 24. A 54-year-old patient utilizing continuous ambulatory peritoneal dialysis and recently admitted to the intensive care unit following a small bowel resection presents as hemodynamically stable with an excess fluid balance of 3 liters. Given these circumstances, how does the critical care nurse expect the patient's end-stage renal disease to be addressed? Options: A, slow continuous ultrafiltration, or that is known as SCUF. B, hemodialysis. C, continuous veno-venous hemofiltration. D, peritoneal dialysis. The answer is letter D, or B rather, hemodialysis. Why is this correct? Well, for patients with end-stage renal disease, the hemodialysis is the go-to treatment, especially for those with fluid overload and impaired kidney function. Take note about the case here. It says excess fluid balance of 3 liters. And the patient has history of small bowel resection. Okay. Following unit, admitted to the intensive care unit following a small bowel resection. So they're hemodynamically stable, but has fluid balance of 3, excess fluid balance of 3 liters or 3 kilograms. And so the hemodialysis in this context is much more effective at removing the excess fluids and also waste products. And even though the patient has been using continuous ambulatory peritoneal dialysis at home, this treatment is not feasible right now. it's because of the recent abdominal surgery. So they need to have that hemodialysis instead. And because they had the abdominal surgery, this will complicate the use of the peritoneal dialysis because of the potential risk of infection and the possible complications in the peritoneal cavity. And so that's why B is the best choice. Now, what is letter A? Why is this incorrect? Well, the SCUF is designed to remove fluids from patients who still have some residual kidney function, but it does not address the removal of waste products like urea and creatinine. And since the patient is likely to have a significant renal dysfunction, given that they have the ESRD diagnosis, then the SCUF would be insufficient for this situation. And take note that the SCUF is more suitable for fluid overload in partially functioning kidneys rather than a full renal failure. Letter C is also incorrect. This is the SVVH. This is used for those patients who are hemodynamically unstable, those patients who have low blood pressure, or those who are in shock, and if they need fluid removal. But in our case, the patient is hemodynamically stable, so the CVVH is not necessary this time. Okay, so CVVH is used as a more intensive treatment, usually for those patients in acute renal failure who are also critically ill and experiencing instability in their hemodynamics. Letter D is incorrect, although this patient had been using the continuous ambulatory PD at home. But again, this is not feasible this time due to the recent abdominal surgery. And this is very risky because it can lead to infection or other complications due to the abdominal surgical procedure. 25. What's the best explanation for why a patient with chronic kidney disease is given aluminum hydroxide? Options. A, it helps cut down on constipation for someone with CKD. B, it lowers the amount of calcium in the blood. C, it binds onto a phosphorus to help lower high phosphorus levels. D, it stops stomach acid from being made. The answer is letter C. The aluminum hydroxide is used in chronic kidney disease patients because they have high phosphorus levels, and the aluminum hydroxide will bind to the phosphorus in the intestines, which will allow it to be excreted through the stool. And we have letter A as an incorrect option. It helps cut down on constipation for someone with CKD. This is incorrect because aluminum hydroxide can actually cause constipation, not relieve it. And so this is an important point to remember when dealing with medications in chronic kidney disease, because so many treatments can affect their digestive system. Letter B is also incorrect. This is because the aluminum hydroxide does not affect the calcium levels in the blood. The primary action of the medication is to bind to phosphorus. Letter D, it's incorrect because the aluminum hydroxide is an antacid, and its role in chronic kidney disease is not to manage stomach acid production, but to help lower the phosphorus levels. And so the key words in this option: stops stomach acid from being made, which is incorrect mechanism, especially that we are talking about chronic kidney disease management. 26. A 56-year-old individual with end-stage renal disease undergoing hemodialysis for 3 hours thrice weekly arrives at the emergency department reporting acute piercing chest pain that worsens upon inhalation, accompanied by shortness of breath during physical effort. The patient's vital signs include a blood pressure of 112/65, heart rate of 126, respiratory rate of 30 with labored breathing, and a temperature of 38 degrees Celsius. A pericardial friction rub is noted upon examination. How should the critical care nurse anticipate this patient's condition will be managed? Options: A, peritoneal dialysis with 5 exchanges daily. B, hemodialysis extended to 4 hours daily. C, peritoneal dialysis with 4 exchanges daily. D, hemodialysis increased to 4 hours 3 times per week. The best answer is letter B, because the patient's presentation is strongly indicating uremic pericarditis. This is a condition associated with end-stage renal disease, wherein the uremic toxins accumulate to the heart due to the inadequate dialysis. And so this will lead to inflammation of the pericardium, and symptoms such as acute chest pain, pericardial friction rub are the manifestations. Okay? And so the appropriate response to the uremic pericarditis is to intensify dialysis, and increasing the hemodialysis duration to 4 hours daily would help improve the toxin clearance, and this will include elevation of the blood urea nitrogen that likely contributed to the manifestation. And so the goal of the amount of dialysis that we're getting in option B is to lower the blood urea nitrogen levels sufficiently to resolve the uremic symptoms, including the pericarditis. Now, letter A is incorrect. We know that peritoneal dialysis is not the best option here because the patient is already undergoing hemodialysis, and the patient has been accustomed to hemodialysis. And so when they're going to be switched into doing peritoneal dialysis, this would not be appropriate given the urgency of the situation and also the need for intensive dialysis to treat the uremic pericarditis. So I'll go back into the clinical case scenario that we have. And then again, the peritoneal dialysis will typically require time for fluid exchanges, and this is not going to be efficient compared to hemodialysis, especially that we are going to manage the uremic symptoms. Now, what about letter C? It's saying again, peritoneal dialysis with 4 exchanges daily. Again, the same reasoning to letter A. Letter D, hemodialysis increased to 4 hours 3 times per week. Is this going to be sufficient? Well, we know that this option increases hemodialysis duration, but it does not provide the intensive daily intervention that is required for the uremic pericarditis. The answer that we have in letter B, daily, and it's going to be 4 hours daily, is very important for this type of uremic syndrome to treat the elevated BUN. And the dialysis 3 times per week is generally less effective in removing the waste products to reverse the acute symptoms that we are encountering in this case. Right? And so what you do in this question is to focus on the treatment intensity and the compatibility with the current care plan. And the most important consideration here is how to intensify the dialysis to quickly address the symptoms of uremic pericarditis. And remind yourself that the client is already undergoing hemodialysis. And so switching them into peritoneal dialysis would be inappropriate. 27. Which action should the clinic nurse undertake for a patient diagnosed with mild benign prostatic hypertrophy who has been prescribed finasteride? Options: A, arrange for the patient to consult with a healthcare provider for an examination within 1 week. B, instruct the patient to consume a minimum of 8 to 10 glasses of water daily. C, ensure that a prostate-specific antigen level is obtained through laboratory testing. D, Provide the patient with a urinal to monitor his daily urine production. The answer is letter C. The medication that we have here, finasteride, is a 5-alpha reductase inhibitor, which is used to reduce the prostate size in BPH. And this can also lower the PSA levels, which is very important for the nurse to monitor before starting the medication, and again after 6 months to evaluate for prostate cancer. And so the key clue in option C is the PSA level, because it directly relates to the drug's effect on the prostate. Now, why is letter A incorrect? Well, we know that finasteride takes 6 to 12 months to show its full therapeutic effect. And so there is no need for an urgent follow-up within a week. So the key clue in option A, within a week, which is too soon for any meaningful change from the medication. Again, the full effect of the medication will not happen up until the 6th to the 12-month period. Okay, so remember that one. Now, what about letter B? Instruct the patient to consume a minimum of 8 to 10 glasses of water daily. We know that staying hydrated is important, and the patient's water intake does not directly affect the efficacy of finasteride. And so the key clue, we have 8 to 10 glasses of water. Am I still okay? All right, I think my audio is still good. We know that drinking enough volume of water can be helpful, but again, this is not going to affect the efficacy of the medication. And this is irrelevant to the medication action due to in treating the BPH rather. Letter D, provide the patient with a urinal to monitor his daily urine production. Well, this is not necessary with finasteride therapy unless there are specific urinary symptoms that need attention. And so the key clue in this option is monitor his daily urine production, which is not a priority in this case. So you have to pay close attention to the timing of the follow-up care and also the specific tests required for monitoring the drug's effects, like the PSA levels in this question. 28. A patient with chronic renal insufficiency who has an arteriovenous fistula in the right arm reports sensations of discomfort, numbness, and prickling in the right hand. What would be the appropriate nursing intervention to address the patient's reported symptoms? Options: A, positioning the arm in a sling; B, raising the arm on 2 pillows; C, administering warm compresses to the arm; D, maintaining the arm at a 90-degree flexion. The answer is letter C. The patient's symptoms of discomfort, the numbness, the prickling in the right hand are indications of vascular arterial steal syndrome, which is going to happen when there is diversion of the blood from the tissues. So this will lead to poor perfusion. And in the syndrome, the creation of the fistula can cause the blood to bypass the smaller vessels that normally supply the hand. So this will lead to insufficient blood flow. It will cause the patient's discomfort. Now, keep in mind that to alleviate these symptoms, the most effective intervention is to promote better blood circulation to the affected area. And that is why administering warm compresses can help dilate the blood vessels, which will help improve the blood flow to the hand, and it will ease the discomfort. And in addition to that, analgesics may be prescribed to help manage the discomfort associated with the lack of adequate blood flow. Now, what about letter A, positioning the arm in a sling? This is incorrect. Well, this is something that could actually worsen the problem, and this will restrict the blood flow further by elevating the arm in a position that decreases circulation to the hand. And with the arterial steal syndrome, the focus should be on increasing the blood flow, not restricting it. And that is why you got to discard this option. Now, what about letter B? Racing the arm onto pillows. Well, we know that this is going to be beneficial for reducing swelling in some cases, but in this particular question, this can worsen the arterial steal syndrome because this can increase the resistance to the blood flow to the hand, and this will compromise perfusion to the hand. It will eventually increase the discomfort. So your goal here is to improve the blood supply, and you are going to avoid the elevation of the arm this time. Now, what about letter D? Why is this incorrect? Well, maintaining the arm at a 90-degree flexion could cause further impairment of the blood flow due to the constricted position, and this could make the symptoms worse. It will cause more compression on the vessels. It will diminish the circulation. So you're going to eliminate this one as well. So for this question, I want you to pay attention to the words discomfort, the prickling sensation, numbness. Again, these manifestations indicate impaired circulation or possibly nerve involvement. So your best option should to select that choice that promotes circulation or tissue perfusion, and you should eliminate those options that restrict the blood flow or increase the pressure. 29. A patient with chronic kidney disease is prescribed aluminum hydroxide liquid. What guidance should the nurse provide to the patient regarding its administration? Options: A. Refrain from consuming water for 1 hour following the medication. B. Take the medication 30 minutes after eating a meal. C. Consume 2 to 4 ounces of water after taking the medication. D. Ensure you drink at least 500 mL of water after the dose. The answer is letter C. That's to consume 2 to 4 ounces of water after taking the medication. Well, this is done to ensure the medication reaches to the stomach. This will help dissolve the medication and to ensure that it does not sit in the esophagus, which could cause irritation. And the recommended volume is 2 to 4 ounces to immediately flush the drug. All right. Now, why is letter A incorrect? Refrain from consuming water for 1 hour following the medication. Well, we know that avoiding water intake after the medication has been taken is not correct, right? Water will help the medication move from the esophagus to the stomach. So if the client is restricted or is not taking water, this will allow the medication to stick into the esophageal lining, and so this can also cause irritation. Letter B, take the medication 30 minutes after eating a meal. This is incorrect because antacids like aluminum hydroxide should be taken on an empty stomach for maximum effectiveness. And when taken after meals, the stomach may already be producing acid in response to the food, and which could make the antacid less effective. Now, what about letter D? Ensure you drink at least 500 mL of water after the dose. This is incorrect because this is way too much. And this can speed up gastric emptying, which could actually reduce the effectiveness of the medication. And remember that aluminum hydroxide works best when it stays in the stomach for a while to neutralize the stomach acid. So your key clue to the option in D is the 500 mL, which is too much. 30. A 70-year-old patient diagnosed with stage 3 renal failure diabetes mellitus, and chronic heart failure, arrives at the emergency department exhibiting symptoms of nausea, vomiting, and abdominal distress. The patient is noticeably drowsy and slightly disoriented. While awaiting the emergency physician's assessment, the patient suddenly loses consciousness, displays no measurable blood pressure, and the cardiac monitor reveals sinus bradycardia with a pulse rate of 32 beats per minute. Which intervention should the nurse initiate immediately to manage the patient's acute condition? The answer is letter C. That is insulin and glucose. So going back into the case, we have a patient that has stage 3 renal failure. And remember about the common electrolyte imbalance that can happen to them. They usually will end up with hyperkalemia, which can cause cardiac arrhythmias, which is exactly what is happening in this question. The patient was originally drowsy, slightly disoriented, and has now lost consciousness. And their cardiac monitor shows that they have a heart rate of 32 beats per minute. So this is a clear indication of hyperkalemia affecting the client's heart rhythm, right? And so to immediately manage this condition, you are going to administer insulin and glucose. We know that insulin can facilitate the movement of potassium from the bloodstream into the cells, which will temporarily help reduce the potassium levels in the circulation to stabilize the heart. And together with that, glucose is also given to prevent hypoglycemia, because we know that insulin can cause the blood sugar to drop. And this will quickly address the cardiac risk associated with hyperkalemia. So remember about the combo insulin and glucose. Letter A is incorrect. This is the Thiazide. So this is something that is administered orally. If the patient is not able to take it orally, this can be administered as a rectal an enema. However, the Thiazide is not something that we should be administering around this time, because we need immediate reversal of the client's condition. We need rapid treatment. And the effect of the Thiazide is not instantaneous, okay? It can work on slowly in the GI tract. It will exchange the sodium for the potassium in the intestines to allow the excess potassium to be excreted. Again, the clue for Thiazide is that it has a slow onset of action. Now, we have an emergency here. We need to treat the cardiac arrhythmias and also to reduce the hyperkalemia. All right. So you have to select that intervention that will quickly lower the potassium level, and there's no other than the insulin and glucose. Now, what about letter B, lidocaine? We know that lidocaine is a class 1B antiarrhythmic drug. This is a drug that is going to treat ventricular dysrhythmias, but our patient has bradycardia. This is a result of hyperkalemia, not a ventricular arrhythmia. And this would not address the underlying cause of the bradycardia. Letter D, amiodarone. What is this drug? This is also an antiarrhythmic medication, specifically class 3. This is a potassium channel blocker. This is often used to manage ventricular arrhythmias like VTAC, ventricular fibrillation with or let's say atrial fibrillation with rapid ventricular response. But this is not suitable in this case because the primary problem is hyperkalemia, which needs to be addressed first. And the amiodarone does not correct the potassium imbalance and would not improve the patient's heart condition, arrhythmia rather. And so for this question, you need to focus on identifying the root cause of the patient's symptoms. And again, go back into the classic manifestations of hyperkalemia. These will point you to selecting letter C. All right. 31. While preparing to administer hydrochlorothiazide to a patient with chronic kidney disease, which findings should prompt the nurse to reconsider the appropriateness of this medication? Select all that apply. Options: A, the patient exhibits a blood pressure reading of 90/60 mmHg in the left arm. B, the patient's oral mucosa appears moist and pink. C, the patient's skin turgor over the chest shows tenting. D, the urine output measures 90 mL over the past 8 hours. E, the patient presents with 3+ edema in the sacral and peripheral regions. We have a select all that apply question. The answers are options A and C. Why is A correct? Well, look into the blood pressure in A, 90/60 in the left arm. We know that hydrochlorothiazide is a diuretic. It will remove excess fluid from the body, which can cause hypotension. And so, given that this patient's blood pressure is already low, the administration of the diuretic could worsen the hypotension, and this will lead to dizziness or fainting. And so this makes it necessary for the nurse to reconsider administering the drug. Letter C is also correct because tenting of the skin indicates dehydration. We know that hydrochlorothiazide can increase fluid loss, and if you administer it to someone who has dehydration, this could worsen their condition. Now, what about letter B? The patient's oral mucosa appears moist and pink. Well, this is a sign of adequate hydration, which suggests that the patient is not currently dehydrated. So eliminate this one. What about letter D? Urine output measures 90 mL over the past 8 hours. So pay attention to the case. We have a client that has chronic kidney disease. And D, which shows urine output measures 90 mL over the past 8 hours, is unexpected finding because of their chronic kidney impairment. All right. So we know that this is low output. It's not unusual for this patient to have this oliguria. So it doesn't necessarily mean the diuretic should be withheld this time. Right. Now, what about letter E? The patient presents with 3+ edema in the sacral and peripheral regions. Well, this suggests that the patient has fluid retention, which is one of the reasons the hydrochlorothiazide is prescribed. And the diuretic will help remove the excess fluid. It will decrease the edema. And so the presence of the edema does not warrant withholding the medication. So for you to correctly answer this question, you have to differentiate between findings that indicate the need for caution or withholding a medication versus those that support the therapeutic effect of the drug. So you have to focus on the signs of a dehydration or hypotension because those are the red flags for the administration of the diuretics. And do not forget to consider the patient's current status. Again, they have also the CKD. 32. A patient with stage 3 renal disease undergoing peritoneal dialysis reports intense shoulder discomfort following the infusion phase. What is the most suitable immediate action for the nurse to take? Options: A, adjust the patient to a right side lying position. B, extend the duration of the dwell period. C, allow the dialysate to drain while positioning the patient in the knee chest posture. D, warm all subsequent infusions to match body temperature. The answer is letter C. And why is that? Well, what we have here is basically a common finding, especially when there is air being trapped in the infusion tubing. And so when this trapped air causes discomfort as it moves through the peritoneal cavity, it will irritate the diaphragm, which refers to the pain to the shoulder. So your goal in this scenario is to remove the dialysate, which will help release the air from the abdominal cavity. And so the knee posture, the knee chest posture, is the most effective position for this, because this will encourage the air to move to the lower part of the abdomen where it can be expelled more easily. And this is going to address the pain. Again, that is the trapped air, and this will relieve the patient's discomfort. Now, why is letter A incorrect? Adjust the patient to a right side lying position. Well, this is something that can be used in certain cases to help resolve fluid blockages, but it does not address the problem of a trapped air causing the shoulder pain in this scenario. And so just putting the patient into the right side lying position would not effectively move the air to the lower abdomen, which is needed to relieve the pain. And so this option is not the immediate solution to the issue we have. Letter B, extend the duration of the dwell period. Well, this is also incorrect, because this is not going to directly address the shoulder pain caused by the trapped air. And the dwell time primarily affects the absorption and removal of the waste products and fluids, but it does not solve the air problem. And I want to remind you that the concern is to relieve the discomfort caused by the air, and extending the dwell period will not resolve the problem. Letter D is also incorrect. We know that warming the dialysate is preferred for comfort and also to avoid abdominal discomfort or to avoid hypothermia. But this is not something that will address the shoulder pain caused by the trapped air. And so we are going to discard this option as well. So for this type of question, I want you to identify the most immediate cause of the patient's symptoms. And you have to recognize that the shoulder pain during the peritoneal dialysis is likely caused by trapped air. And then again, your priority is to remove the air, not just adjusting the fluid levels or positioning, unless they directly address the source of the pain. 33. A patient diagnosed with benign prostatic hypertrophy presents with an increased prostatic specific antigen level. What action should the nurse take? Options: A, inquire whether the patient voided prior to the collection of the blood sample. B, advise the patient to request a colonoscopy prior to interpreting the PSA findings. C, ascertain whether the prostate examination occurred before or after the blood sample was taken. D, inform the patient that a urologist will assess the PSA level every 6 months when it is elevated. The answer is letter C. Why is this correct? Well, because a digital rectal examination, or this is what we call as DRE, is often performed to assess for abnormalities in the prostate. And this can elevate the PSA levels temporarily. And so the nurse should confirm whether the prostate exam was done before or after the blood sample was collected. And ideally, a blood sample for PSA testing should be drawn before any manual examination of the prostate, because we know that the manipulation of the prostate can cause a temporary increase in the PSA levels. Now, if you selected letter A, that is incorrect, because the urination has no impact on the PSA levels. And letter B, it says, advise the patient to request a colonoscopy prior to interpreting the PSA findings. Well, the colonoscopy is unrelated to the PSA levels. We know that PSA levels are used to evaluate prostate health and also are not influenced by the colon health. We have letter D, another incorrect option. It says, inform the patient that a urologist will assess the PSA level every 6 months when it is elevated. Well, this is incorrect because the PSA monitoring should be more frequent than every 6 months if the PSA level is already elevated. And so this will allow, or this should warrant more frequent follow-up to determine the cause of the elevation and also to monitor for any changes that could indicate more serious conditions, let's say maybe a prostate cancer. And so it is not appropriate to wait 6 months before rechecking the PSA level if it is already elevated. So for this question, I want you to focus on the specific details related to the test or the procedure in this question. And for the PSA testing, the most relevant factors are the timing of the blood draw in relation to any prostate examination or manipulation. 34. A patient who underwent renal transplantation has experienced an uneventful recovery over the past 5 days. Which of the following observations should the nurse promptly communicate to the physician? Options. A. Elevated serum glucose levels with a declining state of consciousness. B. Abdominal pain coupled with bladder fullness. C. Elevated urinary output with a reduction in serum creatinine levels. D. Right upper quadrant sensitivity accompanied by increased serum bilirubin. The answer is letter B. That is abdominal pain coupled with bladder fullness. Because the abdominal pain and bladder fullness could be signs of urinary tract obstruction, which is a serious complication after renal transplantation. And this is a common complication in the first few days after surgery. And this must be addressed promptly to prevent damage to the transplanted kidney. And the urinary tract obstruction can impair the urine flow, which could eventually cause graft failure if not treated promptly. And the bladder fullness may also indicate that urine is unable to pass normally from the kidney, and the abdominal pain can result from the increased pressure on the urinary system. And so this must be communicated to the physician quickly because it could jeopardize the success of the kidney transplant. Now, why is letter A incorrect? It says elevated serum glucose levels with a declining state of consciousness. Although there is hyperglycemia, and that is a concern, especially in transplant clients, this is caused by the corticosteroids, and this option's additional finding and the declining state of the consciousness is more likely a sign of hypoglycemia or diabetic complications. And while we know that it is important to manage the blood glucose in the renal transplant patients, this symptom doesn't point directly to a renal transplant complication. And the declining consciousness could be linked to hypoglycemia or could be infection or even toxicity from medications, which would require immediate assessment. But this combination of symptoms does not suggest a direct threat to the transplant graft. And so this is not as urgent as a possible, this is not as urgent compared to a possible obstruction. Now, what about letter C? Elevated urinary output with a reduction in serum creatinine levels. This is not concerning, and in fact, it is a good sign. And the elevated urinary output and a decrease in the serum creatinine generally indicate that the transplant is functioning well. And this is what we want after the transplant has been done. And there's no immediate concern here, so there's no need to communicate this to the physician as an urgent issue. Now, what about letter D? Right upper quadrant sensitivity accompanied by increased serum bilirubin. We know that right upper quadrant tenderness and increased bilirubin levels can be concerning, but there are more likely indicative of issues with a liver transplant if this was performed. Okay, but in kidney transplant patients, if the liver were involved in the rejection, then we would likely see other signs and symptoms such as elevated liver enzymes. And this finding does not point to a renal transplant issue and does not require any urgent communication regarding the kidney transplant. And the primary concern here would be more aligned with the liver function, especially if it was a multi-organ transplant. So you gotta discard this option as well. So for this test question, I want you to look for the signs that indicate something directly affecting the transplanted kidney, such as the obstruction or failure to function properly, such as decreased output, or let's say pain, or complications like obstruction. Let's have number 35. What education should the nurse provide to a patient being discharged home 3 days following a transurethral resection and transurethral resection of the prostate, or TURP? Select all that apply. Options: A, perform deep breathing and coughing exercises every 2 hours. B, alert the healthcare provider if bright red bleeding occurs. C, enhance caloric intake by consuming 6 small meals daily. D, consume a minimum of 3,000 mL of water daily. E, notify the healthcare provider if a fever exceeds 99 degrees Fahrenheit. The answers are letters B, D, and E. Why letter B? Well, because after a TURP, some bleeding is expected in the first few days. However, the presence of the bright red bleeding could signal a secondary hemorrhage, which occurs about 2 weeks after the surgery, when any scabbed or desiccated tissue is expelled. And the patient should be instructed to seek immediate medical attention if the drainage turns bright red. And this is very critical for the nurse to emphasize, because untreated bleeding could lead to complications like clot formation, and this can block the catheter. Letter D is also correct, because hydration is key for a patient recovering from TURP, and drinking at least 3,000 mL of fluids will help flush the urinary system, and this will also ensure the urine stays clear and will also reduce the risk of clot formation in the bladder. Now, letter E is also correct. Notify the healthcare provider if a fever exceeds 99 degrees Fahrenheit, because we know that slight fever in the days after the TURP will be a bit normal due to the inflammation of the body's healing process. However, if a fever exceeds 99 degrees Fahrenheit, this could indicate urinary tract infection or maybe another post-surgical complication. So your role as a nurse is to educate the patient. You have to get the patient to monitor their temperature at home and also alert the healthcare provider if it exceeds this threshold, because the fever might also signal sepsis or maybe other serious complications. Now, why is letter A incorrect? This talks about performing deep breathing and coughing exercises every 2 hours. So these are typically used after the surgeries, where general anesthesia is involved, to prevent respiratory complications like pneumonia or atelectasis. But the TURP is performed under spinal anesthesia, which does not typically carry the same respiratory risks. And so deep breathing and coughing exercises are not so highly needed in this case and make this recommendation unnecessary for this patient. Now, for letter C, enhance caloric intake by consuming 6 small meals daily. This is incorrect because there's no specific need for a special diet after a TURP. And the patient doesn't really face a nutritional deficiency or need to consume 6 small meals daily. And most patients are going to be advised to resume a normal diet as tolerated, with a focus on maintaining an adequate nutrition and hydration. And they don't need to alter the number of their meals per day. And so when you answer this type of question, it's very helpful to focus on the key aspect of the recovery specific to the procedure. And so again, with a TURP, the main concerns are about hydration, also the monitoring for excessive bleeding, and also preventing infection. And you have to eliminate those options that don't directly relate to these areas. So you have to look out for those specific post-op complications and care recommendations associated with spinal anesthesia and also the urinary healing. 36. While attending to a patient admitted from the emergency department with a confirmed diagnosis of ecstasy ingestion, the critical care nurse notes the presence of dark cola-colored urine with a specific gravity of 1.028. These observations align with the onset of rhabdomyolysis. What is a critical intervention to safeguard this patient against the development of renal failure? Options: A, ensuring a urine output exceeding 150 mL per hour. B, keeping the urine pH below 5.0. C, placing an indwelling urinary catheter. D, conducting close hemodynamic monitoring. The answer is letter A. Because in rhabdomyolysis, the condition can be triggered by ecstasy ingestion, and this is associated with the breakdown of the muscle tissue. So this can release massive amounts of myoglobin into the bloodstream. Now, the myoglobin is going to be filtered by the kidneys, and this can cause renal failure when it obstructs the renal tubules. So the primary goal in managing the rhabdomyolysis is to prevent the renal failure by maintaining an adequate amount of urine, so to help flush the myoglobin out of the kidneys before it can cause significant damage. And so to achieve this, you would ensure that the patient has a urine output exceeding 150 mL per hour. So this involves the administration of IV fluids, usually crystalloids, diuretics to promote urine flow. And this will help prevent the myoglobin from causing the tubule blockage and also to prevent kidney damage. Now, why is B incorrect? Keeping the urine pH below 5. Well, this is counterproductive in the case of rhabdomyolysis because when the urine pH is low, it will encourage the breakdown of myoglobin into toxic substances that will contribute to the kidney damage. And in fact, the management of rhabdomyolysis includes alkalinizing the urine, typically with sodium bicarbonate to raise the pH above 6.0. And this will also prevent the myoglobin from breaking down into nephrotoxic components and will safeguard the kidneys. Now, what about letter C, placing an indwelling urinary catheter? We know that the use of the catheter may be done to manage the fluid output, but it does not directly address the primary issue of rhabdomyolysis, which is adequate urine output. And so the key to protecting the kidneys is ensuring sufficient urine flow, not just draining the bladder. Now, letter D, conducting close hemodynamic monitoring. Well, this is something that involves assessment of the blood pressure, the heart rate, and other vital signs, and also important in many critical care situations, but this does not directly address the renal protection that is needed in rhabdo. We need to ensure proper fluid resuscitation and urine production, which is basically the priority in this case scenario. 37. When providing home care instructions to a male patient following a transurethral resection of the prostate, what should the nurse explain regarding the occurrence of urinary dribbling? Options: A, it could develop into a persistent long-term issue. B, it represents an unusual symptom necessitating medical attention. C, it may continue for an extended period of several months. D, it indicates the prostate is undergoing the healing process. The answer is letter C. Why? Well, because after TURP, urinary dribbling is a common issue, and it happens because the surgery can irritate the bladder and the surrounding muscles, which can lead to temporary incontinence. And the important part here is that this symptom is temporary. It can persist for several months, and this is something that the nurse should explain to the patient to reduce any concern about it being an abnormal or a permanent issue. And again, this is expected, and it's not usually indicative of a more serious problem. And so over time, after a few months have passed, the patient will likely regain better control, and exercises can also improve the sphincter function. Now, why is letter A incorrect? It says it could develop into a persistent long-term issue. Well, this is incorrect because after a TURP, it does not typically become a long-term or chronic problem. It is a temporary issue, and in most cases, the patient will regain control over time. Now, what about letter B? It represents an unusual symptom necessitating medical attention. Well, this is incorrect because, again, the urinary dribbling following a TURP is not unusual. It is actually quite a common complication or a common issue due to the surgical trauma to the prostate and the surrounding tissue. All right, so that's generally a normal part of the healing process, and it does not require medical intervention unless it becomes severe or persistent beyond the expected recovery time. Letter D is also incorrect because dribbling is related to the surgery. It doesn't directly indicate that the prostate itself is healing. Rather, it's a consequence of the surgical trauma and the disruption of the normal bladder and the sphincter function. And so the healing process for the prostate does not typically involve dribbling as a sign. Instead, it involves the recovery of the surgical site itself. And the cause of dribbling is more about bladder control rather than prostate tissue healing. Let's have number 38. A patient who has recently received a kidney transplant is preparing for discharge. Which guidance should the nurse prioritize providing to the patient before they are discharged? A. Anticipate a mild and pleasant odor from the dressing drainage for several days. B. Contact the healthcare provider without delay if symptoms such as a cough or elevated temperature arise. C. Gradually reduce the dosage of immune-suppressant medications when discontinuing their use. D. Expect a yellowish discoloration of the skin due to anti-rejection medications. The answer is letter B. Why is that? Well, because the kidney transplant is while they're using the immunosuppressant, the patient is immunocompromised or immunosuppressed due to the use of the medications, and this is done to prevent the organ rejection. And the medications reduce the body's ability to fight infections. So it is very important that the patient understands the importance of early detection, especially if they have an infection, right? So we're talking about elevated temperature. Now, if they are going to have any symptoms of cough or let's say fever, again, those indicate that the client may have an infection, which can quickly become more serious in transplant patients. because the immune system is compromised. And so you have to educate the patient to contact the healthcare provider immediately to ensure that any infection is identified and treated before it becomes severe. Now, what about letter A? Anticipate a mild and pleasant odor from the dressing drainage for several days. Well, this is not expected and could indicate an infection at the surgical site. And if the patient experiences this, it's a red flag that something is wrong and the healthcare provider should be contacted immediately. And the drainage from a surgical site should generally not have a strong or unpleasant odor. So it's crucial to educate the patient to recognize that any unusual drainage should be reported. And we have letter C, says gradually reduce the dosage of immune suppressant medications when discontinuing their use. Well, this is incorrect because the immune suppressant medications are usually required for life to prevent rejection of the transplant. And the only time these medications might be discontinued or adjusted is if the patient is experiencing signs of organ rejection, and that would only be under the direct guidance of the healthcare provider. And so discontinuing these meds without the healthcare provider's approval would put the patient at risk of rejection and could result into the loss of the kidney transplant. Letter D is also incorrect because yellowish discoloration of the skin is not a typical side effect of anti-rejection medication. And this is usually a sign of liver dysfunction, and it's not related to the medications used for preventing kidney transplant rejection. And the side effects of the anti-rejection medications may include increased risk of infection or bone thinning, but not jaundice. So eliminate this one. 39. A patient scheduled to receive belladonna and opium suppositories on as needed basis following a transurethral resection of the prostate should be administered this medication by the nurse when the patient exhibits which of the following symptoms? Options: A, indications of urinary frequency; B, evidence of bladder spasms causing discomfort; C, signs suggestive of a urinary tract infection; and D, symptoms of urinary retention. The answer here is letter B. Why is that correct? Well, after a TURP, patients commonly will experience bladder spasms, which can be very uncomfortable. And this will happen due to the irritation of the bladder wall caused by the surgical procedure. And the belladonna and opium suppositories are prescribed to help relieve these spasms. And this medication is anticholinergic. This will help relax the muscles of the bladder, while the opium component has analgesic effects, which will help relieve the discomfort as well. Now, letter A is incorrect. It says indications of urinary frequency. This is often a normal symptom following a TURP due to the irritation of the bladder. And letter C, signs of suggestive of urinary tract infection. Also incorrect because urinary tract infection is treated with antibiotics, not antispasmodic medications like belladonna and opium. And the belladonna and opium don't address infections, but again, these are intended for controlling the bladder spasms. D, symptoms of urinary retention. This is also incorrect because urinary retention refers to the inability to fully empty the bladder, and the belladonna and opium may relieve the bladder spasms, but they do not directly treat urinary retention. 40. Following a transurethral resection of the prostate, a patient with a three-way indwelling urinary catheter receives ongoing bladder irrigation. In which situation should the nurse increase the rate of the irrigation flow? Options: A, when no urine or irrigation solution is observed in the drainage; B, when the drainage turns a vivid red hue; C, when the drainage is consistent but sluggish. D, when the drainage appears murky and deep yellow. The answer is B. Why? It's because after the TURP, a three-way indwelling catheter is used to provide a continuous bladder irrigation to help flush the bladder and also to prevent clot formation. And if the drainage turns bright red, this could indicate fresh bleeding. And so the nurse should increase the irrigation to help flush the blood effectively, and this will prevent clots from forming in the catheter, which could lead to obstruction. Why A is incorrect. It says when no urine or irrigation solution is observed in the drainage. Well, again, because if there's no urine or irrigation solution observed in the drainage, it could indicate an obstruction or maybe catheter displacement. And in this case, the flow rate should not be increased, but rather the nurse should check for the blockages or reposition the bladder. And the complete absence suggests a more serious issue. Maybe there's a catheter kink or maybe clot obstruction, and this is going to require immediate attention rather than just adjusting the irrigation flow. Letter C is also incorrect. It says when the drainage is consistent but sluggish. Again, incorrect, because sluggish drainage may simply mean that the flow is slower than expected, but it's still consistent. And if the irrigation is working properly and the catheter is patent, increasing the flow rate in the situation may not be necessary. And the nurse could assess if the current flow rate is adequate and make adjustments if needed. But sluggish drainage does not necessarily require an immediate increase in the irrigation rate unless there's a concern about clot formation or other complications. Letter D is also incorrect because the murky or deep yellow drainage could indicate that the irrigation is working and the urine is being flushed out, but it doesn't signal a significant problem. It could simply be normal post-op drainage, and the murky urine may indicate the presence of cellular debris or irritation from the procedure, but it does not necessarily require an increase in irrigation flow. And the increased irrigation would only be needed if there is bright red bleeding. And so the most critical test taking skill for you to use is to pay attention to the subtle clues in the wording of the question and the answers. And you have to look for the key terms that relate to the bleeding. We have bright red or vivid red hue. This is a priority situation because fresh bleeding could lead to clots, and this can obstruct the catheter. Now, if the catheter is steady but sluggish or murky, this does not require immediate action like adjusting the flow rate as well. Instead, what you're going to do is to observe and monitor, ensure that there is drainage to remain clear and unobstructed. And also, do not rush to increase the irrigation rate unless it's warranted by fresh bleeding. And so, this is the end of our Q&A today. Remember, understanding the key concepts like dialysis, kidney transplantation, knowing conditions like the AKI and the CKD will help you feel confident in tackling the NCLEX ARN question. So you got to keep practicing, review often, and don't hesitate to revisit any tricky areas. So your preparation today will pay off when you sit for the exam. So feel free to comment below on how you did in the session, or if you have any questions. Keep up the hard work. You're one step closer to the NCLEX success. So I'll see you next time for more practice. Thank you.